I'm just curious from NP standpoint, in the emergency room, do you see more side effect visits from birth control, or do you see more from ibuprofen, Advil, and Aleve?
Depends what you consider side effects.
So people coming into your emergency room from adverse effects from over-the-counter medications such as Advil, ibuprofen, and Aleve versus birth control.
Right. I would say the main one that we see with like ibuprofen Aleve would be patients who have GI bleeds, because that is one that can affect obviously the lining of the stomach and can make them more prone to GI bleeds. That's probably the main side effect. A lot of times those patients also have other risk factors, whether it be smoking, alcohol, that type of a thing. Side effects from birth control, absolutely. Any number of issues like blood clots, heavy bleeding. The emergency contraceptive, not benign. I've taken care of any number of women who come in with severe cramping, severe bleeding. These medicines have side effects.
Gotcha. I've just, during the time that I have been honored to have patients, I have seen so many more side effects from people coming in on large doses of magnesium, ibuprofen. I was writing down a list here. Supplements. I have so many people coming in with potassium supplements.
Right.
It's absolutely amazing. When it comes to birth control, I've had one in 15 years. And so when we talk about that connection with your providers, right, whoever that might be, your NP, your MD, your PA, there is that connection, but it's hard to make that argument when we have things like ibuprofen, which I see as most common issues with side effects than birth control.
But you're seeing those patients, and that's the point. Even the over-the-counter, primary care physicians are able to discuss those risks of the over-the-counter medications with their patients. This bill is saying you don't have to see a primary doctor.
So are you saying we should get rid of ibuprofen, Tylenol over the counter because we need that connection?
No, I'm saying the primary care physician should be involved. Even those I discuss over-the-counter medications with patients when they come in, but they get to see a physician.
Okay. Thank you. Senator Felzkowski.
Yes, thank you for your testimony. I think the first thing I just want to make a comment. You pointed out that birth control pills are class 1 carcinogenic.
That is what they've been classified as, yes.
But so is alcoholic beverages, and working the late shift are also listed as class 1 carcinogenic. So I think that kind of has to put things into prescriptive. And you also, you point out that you're seeing these people in the emergency room because they're having a side effect from birth control that was prescribed by a physician. So the prescribing of that did not, and seeing my physician did not stop a side effect from occurring. So whether that person was prescribed by, I was on birth control for a lot of years when I was young. I walked in, they took my blood pressure, asked me a few questions, out the door I went. So the post effects are happening with prescription that are provided by a doctor. So that's not going to stop if pharmacists are. And I would ask you one more question. There are 100 countries that allow birth control over the counter. Have you followed up on any of the side effects as a result of that?
I haven't actually looked into studies. We certainly could. I would say that
because as a trend of our medical professionals and the world is moving away from a prescription. So are you saying the OBGYNs, the medical societies, 100 other developed countries are wrong?
I'm saying that it is wrong to ignore the risks of these medications.
No one's ignoring them.
It's wrong to say that a patient and a woman should not have access to a primary care physician.
No one's saying that either.
But that is what this bill is allowing.
This bill is allowing. It also, we do not mandate in the state of Wisconsin that you have to go to the dentist every 6 years. We don't mandate when you go to get your teeth cleaned that you have to see a dentist. Do you believe that people should be able to make their own medical decisions?
Do we make medical decisions with the best help available? Absolutely. And ideally, we should be making them with
So
physician
you do
with-
realize that in this bill, the pharmacist then informs the person receiving the prescription that is recommended, highly recommended, and they give them that says
Right.
you should follow up with a primary care doctor.
I know that's what the bill says. That's my point is and you yourself have said that the access to a primary care physician is not there.
In a lot of areas, it's not.
And so it's nice to say we highly recommend go see a primary doctor because we know these medications have risks, and yet they don't. They
Well,
won't be
we
able
can tell
to.
a lot of people to do a lot of things. People also travel outside of the country and buy a lot of medications in Mexico. We give them that freedom.
But should we be?
But you're
legislating that?
denying those people the same medical freedom in the state of Wisconsin to make those decisions and have access. When the OBGYN Society, the American Medical Society, and others say it's safe. And you're discounting, in my opinion, the risk of pregnancy.
I'm not discounting the risk of pregnancy. Pregnancy absolutely has risks. That's why we encourage prenatal care and seeing a doctor
Yes.
for managing.
But the reality
pregnancy.
in the world is that their people become pregnant. They may not have the access. And maybe they wish that they hadn't become pregnant at this point in time. This is not about not being compassionate to those that do. This is about giving people a choice and allowing them to express their own medical opinions and medical freedoms on who they wish to see. Thank you, Madam Co-Chair.
Am I allowed to respond? Okay. So I totally understand what you're saying. We are not legislating the world. We're legislating Wisconsin. And so from the standpoint of prescription medications, we don't think it is good medical care for a patient who has diabetes to never see a doctor and to just get insulin from a pharmacist, I assume. We don't think it's good medical care for somebody who has high blood pressure and is a smoker and is at very big risk for a heart attack, to just get a blood pressure medication over the counter from a pharmacist and not see a medical doctor. So why this medication with proven side effects? Are we okay with telling women that they are okay to not get any medical advice from a physician? Do physicians do a poor job of discussing the side effects of these medications? Absolutely. And probably not just this medication, probably any medication. That doesn't change whether or not we should be letting pharmacists do it. Do we as physicians need to do a better job of explaining the risks and benefits? Absolutely. But I don't think that should then eliminate the need of a physician to take care of the patient.